The gentlewoman from Fairfax, Ms. Watts.
Thank you, Mr. Speaker. Speaking to the amendment that I believe is before us.
Yes, it is.
Yeah. Thank you very much. Mr. Speaker, ladies and gentlemen of the House, this amendment is part of item 301 in the budget. And it's that item 301 starts on page 257 and ends on page 281. 25 pages of very fine text. So many subsections in item 301 that it goes through the alphabet 4 times, ending currently with N, 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 N as a subsection, and we'll be adding some more to it in the amendments that we just considered. So why is this relevant? Well, when this whole debate began 2 years ago, and the $5 million a day revenue loss clock started ticking, I thought if I just listened hard enough, I would understand what was going on. But as it turned out, by the end of that session, I understood very little. Except I had a new appreciation and sympathy for all of you whose eyes have glazed over when I start talking about transportation funding. Yes, you have. Till it said it isn't so, but I've seen it. Details are as important as they are complex. I know expertise is essential from many sides to craft sound public policy that ensures the best possible service delivery. So, after session 2 years ago, in my vintage Vivian approach, I decided that if I read the budget, I could start building some understanding. I was expecting to have to plow through, maybe 6, 8 pages. Instead, here it is, 25 pages of very fine print. Within these pages, 3 things stand out. First, as I've highlighted in green on page after page after page, there's one provision after another directing DMAS to, quote, seek federal authority, unquote, or seek waivers to expand services. Typically, the budget language then directs DMAS to implement the service as soon as possible without any further General Assembly action, often authorizing emergency regulations. The clear budget policy repeatedly repeated is to authorize the administration to use opportunities to expand and improve services. Second, just in case such broad authorization runs into problems, item 301, as other items before it, starts with the blanket statement, if the Federal Centers for Medicare and Medicaid determine that the process for accomplishing the intent of a part, section, subsection, paragraph, clause, or phrase of this item is out of compliance or is in conflict with federal law and regulation, and recommends another method of accomplishing the same intent, the department should do it. She is authorized to pursue an alternative method. This is the broad language that we've given in area after area. Third, it is very notable that all of this broadly authorizing language is true on 24 of those 25 pages, and that the one exception is the amendment before us. Quote, notwithstanding any other provision, the administration cannot implement coverage for newly eligible individuals under the Affordable Care Act. This is the only place in item 301 where we say no. We won't explore every opportunity. We won't do the best we can to detect cancer or diabetes, to set a bone or immobilize a torn ligament before the joint is so damaged that the manual labor is no longer an employment option, to provide an alternative costly use of emergency rooms. All of us applaud every initiative in the budget amendments to meet human needs. But each time I look at health, mental health, disability services amendments and see that Virginia taxpayer general funds are equal to the non-general funds coming from federal funding, I must ask, how much more could we do if we use 90% federal funding wherever possible, releasing the state funds to meet other pressing needs? This budget doesn't go far enough because we have rejected that. We could do so much more. Let me leave you with what I hope will be a constant reminder of the 390,000 Virginians who could get basic health care if this budget amendment was rejected and we explored every avenue to extend Medicaid to people with incomes below 138% of the poverty level. 138% equals a total income of less than $16,105 a year. 16,000, does that sound familiar? As citizen legislators, our salary is just a little bit more than that. But we all have other jobs and sources of significantly more income. What's more, we can choose to participate in the state health care plan. From now on, every time you get a payroll notice, next May when your asthma is at its worst, September when you're still recovering from the end of summer accident, December when you learn that your sister's cancer was caught in time, and it'll be a good Christmas. I sincerely hope you will be reminded that there are 390,000 people who don't have that care, whose total resources to survive for the entire year are just $16,000. Please reject this restrictive language and let the administration work with us. Let's make use of their expertise, debate it, yes, to fully explore every option to expand essential services to those in greatest needs, and to provide every service with the most effective use of Virginia citizens' federal and state tax dollars. We can do more. Here, the budget doesn't just go far enough. Unfortunately, it steps backward from working together to even try to do more. Thank you.